medicine in general. We have non-modifiable factors. That's your genetics, something that's being passed down, that's within. We can't change your parents. You can't change genetic makeup. So we don't really focus on that because we can't change that. However, we focus on the modifiable risk factors, and that would be lack of exercise, sedentary lifestyle, your eating habits, your nutritional background, the way you eat, the way you were brought up, environmental influences, and so forth. And that's where my mainstay of treatment focuses on those modifiable factors.
Okay, now we know the arteries is where the blood runs through. How does that? How do you use diagnosis and looking at the arteries as a factor in the diabetes testing?
Well, the arteries, that would be what we call a sequela, or an end result of uncontrolled of years, decades of uncontrolled blood sugar, and you would develop what we call carotid artery disease, or cerebral vascular disease, or peripheral vascular disease, and we covered this a month ago with a show discussing what we call atherosclerosis, or arterial sclerosis, or even hardening of the arteries.
Right. Now, what would you say is a macrovascular? And probably that's what I'm leading to.
Okay. Yeah, the term macrovascular defines events that disturb the large arteries of the body, and that would be like cerebral vascular disease, or coronary artery disease, and that's where you would have like an increased plaque formation in the artery itself, where the artery becomes non-flexible. This ends up driving up the blood pressure because the artery becomes rigid, or what we call athero or arterial sclerosis, or the so-called hardening of the arteries.
And what about micro, vascular complications as far as diabetes is concerned?
Right. You can see that the term is very similar, except micro being small, microvascular, small vessels, small arteries. This would be associated to like retinopathy, nephropathy, and neuropathies, and that's based on your eyes, your kidneys, as well as your nerves.
Right.
Where we have, again, the same situation where we have decreased flexibility in the arteries, we have decreased blood flow, and then we have what we call the sequela, or side effects in results a decrease in function of that particular structure. Remember, structure and function is very important in the biology of the body.
Okay, now, how can a person, has any idea or symptoms that, besides coming in to be testing, and we're going to talk about testing with Ms. Grant in a few moments, but people are watching now and they may say, well, maybe if I'm thirsty, does that mean that a lot, give us some of the symptoms that we might know as an individual before we go to the doctor.
Right. We have what we call signs and symptoms. And there are a wide variety of symptoms. Sometimes you might have these symptoms that doesn't necessarily mean you have diabetes, so I just want to clarify that. But signs and symptoms of diabetes, which would lead me to do a finger stick test, or a glucose tolerance test, or a 24-hour fasting test. These signs and symptoms would be increased thirst. You have possibly profuse sweating. You would have changes in your breath, what we call hydrogen breath, and that's due to breakdown of fat tissue in the body, using that for energy. You would have increased urination, difficulty with focusing, fatigue, malaise. You would also have difficulty with focusing with your eyes because of the so-called microvascular pathology.
Okay.
So those are just some of the...
What about dizziness or
that could be
loss of balance?
Yes. You could also have where you have a hypoglycemic event where you might have a lot of blood sugar in your blood. The levels are high, but it's not being driven into the tissues, so the tissues are starving. That would be the same as if you're not eating at all. You don't have any blood sugar in your tissue, so you would have what we call syncope or fainting spells. Okay,
now we mentioned testing, and this is what Ms. Grant does. Ms. Grant, you are a medical assistant, and you work in a team with Dr. O'Brien. Can you show us, first give us a little background quickly, and then show us exactly, using Dr. O'Brien, how you test for diabetes?
Okay. Well, I'm a certified medical assistant.
Right.
And I've also worked with Dr. O'Brien for over 4 years.
Okay.
Okay. As far as testing is concerned for diabetes, you basically simply take one of these two fingers, okay? You'd clean first with alcohol, cleanse the area, let it dry. You take a lancet,
Right.
and you want to make sure that you stick the patient on the side so
Right.
it would alleviate a lot of pain. So basically, you stick the patient.
Well, we're going to put the camera on that, and so the folk can see, because a lot of people think that the testing is going to be painful, it's going to hurt,
Okay.
it's going to, you know, they're afraid. But we want to dismay that. We want to take that away from them so that they can come in and be tested. So do that again for us.
Okay. You cleanse the area. You let it dry. There would be a lancet in this pen, and you basically put it on the patient's hand, press the button. It would be minimal amount of pain. Okay? You turn the finger over this way, squeeze, take a gauze, wipe away the first drop of blood. You take this glucose meter, okay, which has already been calibrated,
Right.
okay? Then you'd squeeze the blood right onto the test strip. You let the patient apply pressure, and then you'd wait about 10 seconds and it would give you a reading instantly.
Just like that.
Just
Simple
like
as that.
Simple as that.
It's simple, but the results of it is very, very significant. Okay, we're going to take a break, and we're going to come back, and you're going to get a chance to call and talk to Dr. Tommy O and ask him some questions about diabetes. And first, we want to thank Ms. Grant for doing an excellent job. And you made it very simple enough for everyone watching to say, I want to go in and do this.
Well,
It's
that's great.
just that easy. Thank you very much. And so we're going to take a break, and we would like you to now make your phone calls, and for every caller that calls in, we're going to see that you get a book, a collector's item, an invaluable book, the Journal of Negro History. And we want your collector's item, mind you, but we want every female that calls in to get this book. And so we're going to take a break now, and we're going to hear some music. This music is our way of saying Happy Mother's Day to all of you. This music, this song is attributed to our mothers, you and you that are out there. Okay, we have run out of time because we want to take your call. So if you're calling in and you don't get through, you leave your name and number, and Dr. Tommy O will get back to you. And for every call, even those who don't get through, we will see that you get this Mother's Day gift. So if you're on the line, you can go right through with your calls as we move on into our program, okay? Dr. Tamayo, how is diabetes treated? And we'll take the first call that comes in. Yes.
Okay.
How is it treated?
Well, first of all, again, we have to diagnose